Okay, so we're going to do some reformer exercise specifically for the core. So a few things before we start that I want to say is we want to remember, I'm probably going to be talking a lot and moving a lot, but you want to remember good alignment, good posture, all of the pelvic engagement that we talked about, transverse engagement that we talked about through everything that we're doing. You want to remember to keep your head in line with your spine at all times so you're not twisting or lifting up or anything like that. And I'm, for the sake of time, probably going to go through these kind of fast, but Pilates is really about, and reformer is about slow, super controlled movements, not rushing through it, not how many reps you can do or anything like that. So the first thing that I wanted to show you guys is we talk about like finding your like pelvic neutral, and this is another good way I think to do it is just sit here, so no springs on, and then a quick thing about the springs, green is going to be the heaviest, blue is going to be the lightest, and red is in the middle, just so you guys know. The foot bar you can adjust for your height, you can put it down, depending if you want the patient's like knees flexed or higher up, all of that can be adjusted. So I have no springs on right here, so I can just move back and forth like this. So just to kind of help, I think the hardest thing is like associating your spine, disassociating your spine with your pelvis, and like being able to move them separately. So we can put our hands on the foot bar. All of our springs are off, and then you can kind of just instruct them to use their bottom to move the carriage all the way out, and then to move the carriage all the way in. So then just doing that is going to help them find their neutral pelvis. So if they go in, and then out, and then wherever they feel like their sit bones are right in the middle, that's going to be their neutral pelvis. So that's going to help them find that. So that's a good thing to start with people if they are struggling with that. And to tell them to elongate their spine all the way up while they're doing that. And then from there you can kind of do just like some spinal mobility stuff just sitting right here. So you can come all the way out, keeping the back straight and the head up, and then flexing the spine all the way in and rolling down like this. And this is just like to help them mobilize the spine, just help with some movement, really slowly. We can also put the arms on each side to get a little bit more of like a rotational component. So that's a good way to start. Another thing, we're going to do some feet and straps. So for this, I'm going to do, it's going to be different for everybody. I'm just going to do like a red spring on here right now. So you want to help your patients get on here, of course, especially if they've never used this before. It's a little, it seems scary, but it's really not. You're super supported.
You're almost there. Down a little farther. There you go. Help her out, you guys. Our new patient. Let's make sure she gets us. There we go.
So,
Sorry. She needs to help, right? Oh my God. Well, her legs, okay, there you go.
so
Thank you, assistance.
You're welcome.
Appreciate it.
once they're able to find their neutral spine, so you want them to do this in a neutral spine, so find that position, and then we're going to lower the legs up, and then lift them down, and you want them to go as low as they can still maintain that neutral spine. So that's going to be different for everybody, and only as high up also as they can maintain that neutral spine. And then you can also do like some leg circles here, which is a little bit harder. And once again, transverse is really engaged, pelvic floor is engaged, and you want that engagement to stay throughout the entire exercise. Now something that's a little bit harder is you can do like articulating the spine all the way up, so that's going to engage transverse, deep core, and you're going to use that to roll your body all the way up like this. And then you can kind of come down. Once again, this is like once they feel comfortable. And then slowly, don't flop, kind of roll all the way down. And extend the legs out. Give it a go, Lindsay.
She goes, I know that's right. So now is there an easier one of that, an easier level for that?
So I think the easier level would just be
Okay.
doing this.
Gotcha.
Or you can just kind of roll up like
Just part way.
just part way like this. So this is still a lot of like core engagement to stay like this, and then go.
And then to control it coming
Yeah,
down.
control it.
And
coming
don't
all
forget
the
to
way
breathe,
down.
right?
Yeah, that's another one. Don't forget to breathe while you're doing all of these. Don't talk all the time like I am.
Well, you're breathing when you're talking, though. It's Lindsay over there that's holding your breath.
I am holding my breath. It's hard. So then you can just come out of the straps, hold on here, pull down.
Nice job.
And then what else? So we kind of did a little bit of this with Professor Johnston the other day. So kind of like jackrabbits or planks you can do from here. So you can come out like this. This is a good like kneeling one. Once again, so you're gonna want to make sure that you're kind of tucking the tailbone under a little bit, so you're not doing this. You're like this. You're in that neutral spine. You're doing these. And then we can also progress to like planks here, and then you can move out and in. And another thing I wanted to show was we did these the other day, and I think that a problem for planks like this is a lot of people don't like putting that much tension on their wrists. So you can take the box like this. Oh, and for planks, it's going to be kind of the opposite of what you would normally think. So the lighter resistance is going to be the most difficult because the carriage is going to move more freely. So I have this on a red spring right now. You can put it on like a blue if they need a lot of stability, a green if you want to get really crazy when you start getting into functional movements, no springs at all. So for this, you're just going to slide the carriage back like so. Put the box here so it's stable, like so. And this way they can do it on their hands still if they want. They can also do it on their forearms, which most of your patients are going to like better, I think. So then same thing, you can do all of your planks from here. You can do like rotations, just think like normal plank progressions. Good alignment once again. You can also do a more advanced exercise would be like piking. So you're going to lift from the hips right here, and you're going to bring the carriage all the way in, like so. Out. So my wrists and shoulders should be aligned. And we're lifting from the hips, drawing the core in as we're doing that. So you can do any plank stuff like this, push-ups, whatever's most beneficial for them. Another one. Oh. So, you can take the box off. So you can use your foot to take it off, slide it out, lift it up, bring it back in. Alright, let's try this one. So this is kind of like a scooter. It's like a little bit of like a lunge. This is going to be good to help with spinal alignment. So they're going to put their foot back here. They're going to kind of lunge back. So head in line with the spine. We want to make sure that we're not slouching. We're in good spinal alignment. And then you're going to lift the foot off the carriage. And then maintain that alignment while you move the foot in and out. And then when you want to make this more functional, so we're thinking like gait, dynamics like that, you can have them take the arm off, move the arm with them, because this is kind of how we walk. You can have them turn their head to incorporate like more balanced stuff. So, that's a good one. What else? So this is another good beginning one is, so this will help a little more with like spine articulation, helping them move the spine. This is just kind of like a beginning like roll down series. So we're gonna be here, put our hands on the straps here, feet between the headrests, and then you're just gonna practice slowly. So they're gonna tuck the tailbone under, and then roll the spine down as far as they feel comfortable, and then roll back up.
And your spring for this, what would you recommend?
So this is going to be the same thing as the planks. So the lighter spring is going to be much more difficult. The heavier spring is going to be easier for them to maintain control. So just depending on the level of their patient. And then red is kind of like neutral. But you really are, I know it looks kind of weird, like there's like this open space behind me, but you're very supported like in this position. Do you feel secure?
Yeah, as long as I don't let go.
And then another one is, I know we've gone through kind of like footwork, but so this is like pretty basic. It's just sitting here, and this is going to help. So Professor Johnson showed us the supine arm work, which is a really good one. But you can also just have them, probably on like heavier springs, you can load up like most of the springs for this, and just have them kind of disassociate moving their pelvis with moving their spine. So just have them practice moving their legs in and out, and not like tilting the back up or down while they're doing this. I think this is like a good starter exercise. Oh, and also for the planks, you can do like side planks as well. I didn't really show that, but same thing as you would think like regular planks. Side planks, you can dip the hips up and down, you can do thread the needle, all of that. And then side planks you can also do, to start, just like a kneeling side plank like this if you have the box here. And then with one leg up and one leg down, just like this. So now let's talk a little bit about like oblique stuff. Lindsay loves these already because I've already showed her.
Oh boy.
So this is going to be a more, definitely a more challenging exercise. So for this one, we want to load up pretty much all the springs for stability, just to keep the carriage stable while we're doing these. So you have this safety strap underneath here that you can put your feet under. And you're going to put your foot in.
Well, I think Lindsay's box is like, you have yours all the way over. Does that matter?
Yes, that does. So if you're taller than like 5'5", so I'm about 5'5", you want to put it over the shoulder pads. And then if you're shorter, you want to put it under the shoulder pads. So that's going to help with, because when you stretch your leg out like this, it's going to help depending on your height. So once again, this looks kind of weird, but you're super secure. My foot's in the foot strap. I'm not going anywhere. But you want to help your patients get into this position because it's going to feel kind of uncomfortable for them. So to start, you can have them keep their head on the headrest and just kind of move up and down, and they can use their arm for support here. And this is gonna, so we want them to be in a straight line. We don't want them like bending or anything like this. This leg should not move at all. It should be totally stable, totally secure. So you can just have them moving in and out with their hand on the headrest, trying to just activate the oblique at first, just practicing that engagement. And then we progress from there. So then you can have them either keep their hand here, put an arm over their chest, lower down like this. Then once they feel really secure, hands behind the head, lowering straight down. So when I'm coming back up, I'm like kind of arching, like I'm like going over something here. Like I'm like rainbowing over and then rainbowing back down. This is also a really good stretch for people to stretch their obliques. They can just kind of hang out here, or they can hang out here with their hands like on the headrest. Another, like once they get really secure, like a functional one is adding in rotations. So you're here, you lower down, you look down, you come up, and then come back up.
She did good.
How's it going over there?
We did the first one.
Good, good.
The one that we did last time.
So now let's try some more. So we did the roll downs, like holding the straps this way. So we can also do it this way. So we're gonna put our feet securely in the straps like this. So once again, I'm stable, I'm not going anywhere. So you can have them either roll down like so and articulate the spine down, or you can have them do this in a neutral spine depending on your patient. And then roll down. You'll feel like a nice little shake here when you're doing it right.
Yeah.
And then roll back up. And then we can progress from there. We can take a foot out.
Are you nuts?
Keep my feet in.
Yeah.
And switch feet. You can also do like rotation here. And once again, I'm super secure. I know that this looks like I'm just like hanging out, but when your foot's in that strap, it's in that strap. So it's very secure feeling. So now we're gonna move our backs. We're gonna go long ways. And we're gonna do, we'll say, like a blue string onesie. So for this one, I like to put the headrest up, and you'll see why. Support my arm, and you're gonna lay down on your side this way. So we want to keep our side straight throughout this entire movement. And we're going to reach over and put our foot down here. So this is, I mean, it's glutes, it's lower body, but it also is a lot of core work to keep your body in a straight line like this. You want to instruct people that tell us in class, like to engage your transverse, is that at any time they should be able to walk up and put their hand under, like you're corseting in your spine together. And then so you can start here, so foot should be in line with the hip, and you can just do like some small circles. And it's pretty difficult to kind of keep your spine engaged while you're doing this. Your patients are going to want to do this. Don't let them do that, just like small circles. And then something that's a little, once they feel comfortable with that, they can move forward and then flex the heel and pull back. And you're going to feel a lot of oblique and abdominal engagement to keep my hips from going forward like this, and just keep them going back like that. And then we talked about how like the glutes and some of our pelvic floor muscles connect in through here. So that's all like just one deep body connection right here. And you can do a lot of like different movements. You can do like marching here. You can, if they're able to externally rotate and keep the hip stack, they can externally rotate like this. You can change the spring tension, you can add ankle weights, you can do all of that as people like progress, but this is a good like starting area, I would say. Feeling it?
Yep.
Okay. there, and then another one is we're going to do that kind of similar but in quadruped. So like this on the box. So wrists above elbows, you want to be in really good alignment. You're going to have them do some stuff to find their neutral pelvis, and then once they feel comfortable, so you can do this without the strap too, obviously. You can just do, this is a good like starting area, is just to have them do this and practice keeping their spine straight. And then once they feel comfortable with that, we're going to take the strap, put it here.
Your helper's coming.
You got it. You got it.
Thank you. Yeah. Thanks.
So knees should be under hips, like we said. So, and we're going to kind of shimmy to the side of the box where the strap is on, and then kind of bring the foot down, and then bring it up. So this is really a lot of core engagement to keep your body in the right alignment for this, and this is definitely like a more functional exercise. You can do the same thing, you can do like marching, all of that. And then, while I'm here, I'll just show a couple of like spinal extension stuff. Is you can do like a prone press up on the box. It's fine.
Okay.
So
We will have this at graduation.
Experienced versus inexperienced. Okay.
So chest is
You're
off the
doing great.
box. So we're just gonna put our hands here, press up, and then depending on how mobile their spine is, this is obviously for people who are extension based. They like extension, and then you can kind of bring your arms all the way in so the carriage touches. You can come out like this. So, and you want to keep your legs engaged too while you're doing this. They're not just like hanging out. They're pointed. Come up and come down. And this will probably feel really nice for people who like are H&P patients. Like that. And then you can also do, sorry Lizzie. So extension stuff this way. So we're going to grab onto the straps. Once again, feet are engaged. You can just kind of have them start like, you don't need a ton. You can just kind of have them slowly lift their chest up this way. And then you can have them start doing like some swimming stuff.
And is that a progression? Is that more difficult than the way you were doing it before?
Yes, this
Yeah.
is definitely more difficult than what I was just doing right there. So this would be like a progression to that, I would say. So grab right here. You're like a swan. You're beautiful. Okay, so you can come here. I mean, you can have them do like tricep stuff too here, like while they're doing it. Good job. Good job. And then another good one for kind of like a beginner, like oblique, like rotation stuff is, So we'll just have it on a blue spring, probably the lightest spring for this. So we want to work on that good posture right here. We're engaging the core for everything. We're keeping the head in alignment. So we're going to take the strap like this, and then we can kind of rotate in like this, and you want to keep your spine stable. And then once you're here, you can do stuff like this way. And you're really going to feel that in the obliques right here. But this is definitely much easier than like the stuff I did on the box. So this is kind of a good like starting point. Let's see, what else? So all of the stuff that Professor Johnson showed us the other day in our pelvic floor lecture was awesome. So I just want to touch again on like the supine arm work and like a little bit of progressions from that. For like the bridges and stuff, you can kind of follow that as like a normal progression, the same way you would progress a bridge here, you would progress it on the reformer. So like single leg, like she said, you can move it in and out. And then when you have people laying down like this, make sure that they have the headrest down, because you want their spine to stay and their cervical spine to stay in alignment. So you can come up, you know, like this. You can have them just come up like this as like a good starting point. You can come here, and then you can start doing like single leg stuff. You can have them raise and lower the leg. You can have them move the carriage like in and out, all of that. Same as the normal bridge progression. And then for the supine arm work, this is a good one. So when we were doing this the other day, tabletop, when we talk about tabletop, we all have a tendency to kind of go like this, because this is cheating. So you want to be really like 90-90, or with the leg like lifted a little bit. So be aware of that. You should feel a lot of core engagement just doing this. And then to progress this with your patients, you can have them do stuff with the arms. You can have them circle the arms while maintaining that spinal stability. And then once they feel more comfortable, you can have them start lifting the head and then lifting the legs. You can give them a ball. That's going to get good like pelvic floor engagement while you're doing this. I mean, there's so many things that you can do with this. You can have them like, you know, rotate the legs and lift the head. They have us do like snow angels, so like this. So that's a really, really good one. And while we're here too, when you have your patients like this, when they've just done like supine arm work or something like that, it's really nice to do like a little stretch, like where you just hold on to the headrests and then just kind of rotate. And this is nice because when you do this on the floor, your legs usually kind of stop, but your leg can just drop all the way down. And it's going to feel really nice rotation on your spine. And so if someone has like a compression to one side, this would be really nice to put them on the reformer and then just let them like stretch out their spine like this.
It's a nice quadruped stretch.
Yeah. Oh, and then another stretch that you can do is, we call it the Mermaid Stretch, and it's kind of a lot of coordination. By the way, whoever has me for soft tissue today, I'm going to be really sweaty, so you just prepare yourselves for that. So, hand is here on the foot bar, and you can kind of just come over like this. And this is going to feel really nice on the sides, stretch all of our obliques, all of our quadratus, all of that. And then you can have them come up, and then come over to the other side. And then they can do that as many times as you like. It's a good stretch. I think that that's mostly it.
So one quick question, is there something in the beginning you do, like with foot placements, with them being here versus here, right for the spine?
Yes.
Can you
So
go over that?
I mean, so we do, I mean, you can just do like feet in parallel versus, like we call this like Pilates V, which is like heels together, like toes apart. You can do just like toes on the foot bar and heels together. I'm trying to think of like when that would be appropriate versus, this is good like pelvic floor engagement if you have like your heels together and your toes apart like this. So you can do like any footwork or even like our feet and strap stuff that we're doing. If you have your heels together, you're really engaging like your adductors and all of that, and you're pulling down like that. And you can do the same thing. That's a good like starting point with like footwork, just to help them find their pelvic floor. Actually, that's really nice. Like it's a good cue. So then let their knees come out and then press them together like that.
Cool.
And I think that that's pretty much it. And then, I think that's pretty much it.
Awesome. Thank you, ladies.
Yeah, so, I mean, if anyone has any questions, feel free to find me, or if you want better advice, find Professor Johnston, but, all right.